We're using 0.9 normal saline, and notice I've opened it already for this morning's class at 8 o'clock. So I'm going to, it's good for 24 hours. And it has two caps. This one snaps pretty hard when you take it off and it's discarded. This one is the sterile cap, and what's inside here is considered sterile. Now, it can be used for irrigation, therefore you have the big hole there. Now, what goes in there is a big tubing, where if you were using it for irrigating a big wound or something, you could use it. I've never used that feature.
Question. Since you said it was sterile,
Mm-hmm.
you're touching
The outside, which
On
is
the
not.
inside is
The
sterile.
inside is sterile.
Sorry.
Of any bottle. That's true. And so we're going to prepare our tape. Now, if I didn't think I had enough stuff in this, it has 10 gauzes in it, but if I'm the first time nurse taking care of the patient, I might not know how deep that wound is. And so I might decide, just in case, to add a few more gauzes. And you can do that. You can add these. Now, when you're coming to test, you need to have an extra set of gloves in your pocket in case you mess up. Okay, you don't want to be able. You don't want to have everything out, contaminate your gloves, and then don't have another one. That means you fail. You have to do it over again. You don't want that, right? All right, I'm going to set this aside so I can set my tray up. This part here, it says here, peel both layers at the corner, one layer, two layers, and you snap it open, and then this slides out. And I'm just going to use this as a garbage can over here.
You could do that in real life, right? Just use it as a garbage.
Sure, but if it's real saturated, it needs to go into a red bag, which is in there. So the next thing we need to do is open this and get the first three items out. This is going to be a drape that I'm not going to use as a sterile drape, the red bag, and the gloves. So we're going to pull this here and go away from us. This side goes this way. You lose left hand here for this one. And this one here, and I'm going to move it like that. Now I can touch underneath it. I can touch anything that falls over is considered contaminated. Anything below my waist is contaminated. I can't cross over my field. I can't turn my back on the field. And now I want to get all three things in here. So it doesn't matter that I'm touching the blue thing, because I'm going to take all three things out with my hand. The gloves are on top because they want you to use that first, or get it first. And then I'm going to take this. Don't grab it here. It's too close to the gauzes. You're going to grab it in a place where you can retrieve it out. And notice I had used this morning, so you need to learn how to refold your pack so that you can practice again. This is like a Chuck's. Shiny side down. You don't have to worry about putting it on there sterilely. Pick this up by the tab. Save this for later. Open your bag. Don't do this. Open your field. Okay, and we're going to place this here, just in case there's something sloppy that comes out of that. Okay, now I can't go into there at all, and I still have my dressing on. So once you have all your equipment out like this, and if you really think about it, and I look, okay, if you put your gloves on, you haven't taken that off yet. So you have to go, okay, let me do that next. Here's my exam gloves. I need to use that next. So we're going to come over. The wound was dressed this morning. This label tells you when you need to do the dressing. Some of them on Health South, they have some old dates on them, like several days.
And then you're like peeling it off.
That's right. And we're going to peel this off like this. I don't like to do dressings, I don't think. There. Now, I'm going to look under here to make sure I don't pull out any drains. Once you pull out a drain and have to call the surgeon to tell them, I pulled out your drain, you're gonna feel horrible, and you have to write an incident report. So you're gonna take this off. I'm gonna leave the rest of that and get it with the forceps that are in there. I'm gonna look at what I've taken off to see how much drainage there is. Does it have an odor? What's the color? I'm gonna get rid of this now. So in terms of the two dressings, the dry dressing and the wet to dry, this one has a lot more steps. Okay, coming over here. Now, if I'm gonna loosen this up, you can even take it off if you want to. If you forget that step, you're gonna, with your sterile gloves on, you're gonna do this. Of course, if you squeeze it too hard, you're gonna get your left boob all wet. So don't squeeze it too hard.
Might be sexy.
Okay, cuff end is here. Now, if you open this like this, you've contaminated the field because you're inside it more than an inch. So you pull up the trap door. You can only touch this part. You come up. It's the same as the last time I did this. And then I'm gonna, the talcum, notice how the talcum really made it much easier to get this on. Now, you know you're gonna go right like that. So put this hand behind you and start taking out everything to see what you got. We need all these gauzes. We need that. I don't need this. So if you don't want it, just drop it here or leave it on the side. You can leave it in the patient's room. And now I'm ready to pour my solution. And because this is closed, I can reach over here and get it. Now, if I haven't loosened this up, you're going to do it this way. Loosen it up. Place it cap side up, because that's the sterile side. Pick up your tray. Notice how I have the label up. I'm stepping away because you don't want to pour onto your field. And you don't want to touch this together. If you splash your shoes, you splash your shoes. And you pour. Okay, that is placed back. This is placed there. If you pour too much in there, it gets kind of heavy to put it back. Now we're going to go over here. Reach 4 fingers into the cuff. Hitchhiker thumb out. Got my thumb I got my finger into the thumb, the wrong finger. Okay, so we're going to go over and retrieve these. Okay, you're looking at the drainage. And you're looking at the wound itself. It's really fairly clean. And so now I'm going to, I can't return this to the tray. It's been in the patient's wound. So I'm going to, you can either put, this morning I showed them, I did all 3 and wrung them out and put them over here. You can do that, or you can do it now, as long as this doesn't go back in there. Now, this gauze here is too close to the edge of the tray. So I'm just going to get rid of it. I think I have 3 here. You can use both hands now, and you want to get the mesh out. You're elongating the 4x4, and then you're going to stuff that turkey gently. This morning, Rose was going, oh, oh. Rose, it's tender. Okay. You have all those nice edges up against the wound, and you feed it in from the, you don't want to put it on the abdomen, you don't want to drag it from here into there. So you grab it with this and guide it with your forceps. And you don't stuff it like you do your turkey at home where it's so stuffed you can't even get the legs together. You want to gently put the dressing in there, so where it's just up to the top of the wound. And you don't even have to use the other one if you don't want to. I think I have enough, and I don't need this anymore. I can't return it to here. It's going to go in Sharp's container, but for now I'm going to just throw it there. I'm going to do my Subway salami sandwich. And it's up to you how much of this gauze you want to use. I like, because of the wick action, I like to use quite a few layers, because this is what's going to protect the patient from the outer dressing getting dirty. This goes here. Notice how when you pick this up, you don't handle it here. Handle it like a Band-Aid at home where you put it like this. I never touch the pad of the Band-Aid. Pull this down like this. This goes like this into your tray here, and you're ready for taping. You can use the skin prep at this time. Would be a nice time to use it because you have your 2 hands free. Now, if this patient was, this is close to the pubes area like that, you're gonna not wanna give them a Brazilian wax with the tape, so you might have to shave it a little bit. Otherwise, every time you take off the dressing, you're gonna hold your breath. As you yank it off. Okay, Caroline, let me use your pen again. We don't want to write on the patient. I was, Abby, remember Abby did that? She didn't hurt the patient, but the patient was nervously looking at her because the dressing was over the patient's knee, and she had an incision under there, and Abby was signing her name right up to the top of her incision. It was
No, the lady at our place was like, "You're not supposed to do that," and she's doing it, but she told us, "You're not supposed to do that," because she forgot. She put the cover on and then forgot.
Date, time, initials.
And then this is going to go into, this can go into there, and if it's saturated, all of this can go into the regular garbage, because there's nothing contaminated in that. That has to go into the red soil, into the soil utility room, into the red garbage container.
Why don't we use the red bag to help them?
I'm not sure if they have red bags.
Yeah, we
Most
did.
of their dressing